Hello, hello, hello. My name is Kay Patrice Williams. I am thrilled to bring you another episode of Red Alert. Let's talk about it. Let's talk about World AIDS Day. I am Kay Patrice Williams. I'm your host. And we have another host. I'm going to show you who she is, one of my favorite people in the community, Dr. Lakeithia Lake Pasqua.
Hello.
Hello, how are you?
I am great. How are you?
Oh my goodness. I feel like we've been waiting for weeks for the show. We've talked about it, we've prepped, we've talked about it some more, and finally the day and the hour is here. I'm so excited.
Yes, so am I. I'm happy to be with you again, yet again, in collaboration for another Red Alert Town Hall.
Yes, yes, yes. So let's tell our audience who is watching live and maybe watching the replay. Let's talk about it. What are we talking about today?
Well, thanks. I'll go ahead and kick us off with a welcome on behalf of Dr. Dila Morris, who is the president of the Vallejo Alumni Chapter of Delta Sigma Theta Sorority Incorporated, who could not be with us, unfortunately, but wants to extend a warm welcome to all of you for joining our Red Alert World AIDS Day webinar. I am the co-chair of the Social Action Committee for Vallejo Alumni Chapter. And for those that don't know, Delta Sigma Theta Sorority Incorporated is an organization committed to sisterhood, scholarship, service, and addressing social issues of our present time. And tonight's session is a continuation of our Red Alert series. So, our first series actually was in June of this year and was on redistricting. And the Red Alert series is where we aim to bring to light social issues that impact our community. And tonight, in observance of World AIDS Day, we will have a conversation about HIV, AIDS, and sexually transmitted infections or STIs. And we'll provide education, share resources, have some dialogue this evening, and at the conclusion, we will deliver a call to action. We always want to have a call to action for our community and those that are joining us. If you have questions as we go along, please feel free to type them in the chat and we will address them there. So, with that, Kay Patrice, I'll turn it back over to you again as our technical moderator. It is a pleasure to be working with you again.
It's always a pleasure to work with you. Every time that I get a call from you or Rhonda Smith, I know that it's going to be inspired work and necessary work. So thank you so much. And in knowing this topic, I know that this is a necessary conversation. And with that, I would like to bring on our special guest of the evening, Robertson Somaya. And he's going to tell me if I pronounced his name right.
It's Samoa. You almost got it. You almost got it.
How are you?
I'm wonderful. How about yourself?
Good, good, good. Well, I tell you, we had a pre-call, and before the pre-call, there was a prep about you and this conversation today. And in just that little bit of time, I've learned so much, and I know how necessary this conversation is. I have a little bit of your bio because I want the audience to get to know you, and if you don't mind me giving a little bit of your bio, that would be amazing.
I do not mind.
Um, so, Robertson, you know what? Tell me how to pronounce your middle name.
Quissy.
Quissy. Beautiful. Robertson Quissy Somaya. MPH saw a need in the community for healthcare and decided to take on the issue as a personal and professional mission. You started your public health career in 2009, working at an emergency room in Vermont after completing your bachelor's at State University, New York, SUNY. And you say, I learned more there that I could in any education setting. You see so much trauma, and I was engaged with a lot of people. It was a one stop shop where everything could go wrong. But working with the patients in the ER gave you a way to engage with people on a personal level, even, even among the trauma. In this level one trauma unit, you saw a gamut of medical issues, but the one thing that stood out there were the regulars that would come into the clinic, underserved people that would come into the ER for many issues that should be treated by a primary care physician. I could see the discrepancy in the healthcare of many of these people. And they really needed basic necessities before they could come in for treatment. That is what made you decide in your future career in global and community healthcare. When I approached the challenge, I took the minor and macro issues. The macro issue is community healthcare. The macro issue is global healthcare. This understanding led you to find Touro University, California, to TUC in pursuit of your Master's of Public Health degree. This is a dual degree, physician assistant, MPH program, and it really offered you this rare opportunity to obtain this dual degree. That's a powerful resume. I know it was long, but it really, to me, when I read your bio, I could really see who you were, and where your heart was. So, welcome.
Thank you so much. It's wonderful to be here, and it's a great opportunity to share some of this knowledge with the community as a whole to help us protect ourselves.
Yes, yes. Well, I know that you have a presentation. Um, Lakeithia and I will stand by and support you in this presentation. Ask you any questions, and then at the end, we will we will have a conversation dialogue about it.
Okay.
Okay, let me bring up your screen, and it is live.
All right, perfect. My name is Robertson Soma. I'm the Senior Health Education Specialist for the Communicable Disease Program within the Solano County Public Health and Social Services Division. And I will be doing an overview presentation on HIV and sexually transmitted diseases or infections. And we're going to be looking at data trends. We're also going to cover what affects our sexual health and the connection between STDs and HIV. So first of all, we have to start from the basics. What is a communicable disease? So a communicable disease is a disease that can be transmitted from one person to another or via a vector such as a mosquito or any other organism. And so in the state of California, the three most common communicable diseases in California are chlamydia, gonorrhea, and syphilis. Pre-COVID-19, for every 10 cases of communicable diseases, 7 were caused by chlamydia. STDs, that's sexually transmitted diseases, account for nearly 9 out of every 10 cases that we see in California. But I like to pull the data and look more at what is going on in the county. So last year, we all know that we were at the forefront of a global pandemic that we are still going through. However, our bureau was responsible for doing all the investigations for these COVID cases, but we were also seeing a significant increase in syphilis cases. We saw 256 confirmed cases in syphilis. And the last time that I looked at the data for this year, we were already at 134 cases in the middle of this year. And if you look at it overall, syphilis cases can be like around 3,800 cases averagely a year in the state. So imagine how things have changed to the point whereby we in just one county are seeing these high numbers. So it's definitely something that we need to think about and consider the ramifications of. And we're going to do an overview of how that can impact our chances of getting HIV. So I just took one specific disease, gonorrhea, out of the 3 top sexually transmitted infections that can be transmitted easily in people. And just to give you a little bit of an overview of the age groups and between male and female that seems to have a higher frequency of this disease. And we can see from the graph here that mainly for men, it's between the ages 20 to 44. That's where the higher numbers are coming from. And for women, we see the higher cases from the age of 15 to about 34. The reason I show a graph is to show you that so a disease like gonorrhea its transmission is very similar to syphilis, to HIV, and it shares also some of the same demographics. So it's something that we should be cognizant of. And but one thing that seems to have a huge impact in people getting tested and people talking about HIV and STDs is stigma. Specifically for HIV, stigma is negative attitudes and beliefs about people with HIV. It is the prejudice that comes with labeling an individual as part of a group that is believed to be socially unacceptable. For a few examples, believing that only a certain group of people can get HIV, when people make moral judgments about people who take steps to prevent HIV transmission, and feeling that people deserve to get HIV because of their choices. And you can substitute HIV with chlamydia, gonorrhea, syphilis, a whole gamut of diseases. The stigma prevents people from actually accessing healthcare and actually getting tested. So it's very important that we talk about these conditions so that we can have a more positive attitude towards it so that more people can get the help they need. So HIV, what is HIV? So HIV is the human immunodeficiency virus. And HIV leads to what we call AIDS, that is the acquired immune deficiency syndrome. HIV transitions to AIDS when your immune cells, we call them CD4 cells, that those are usually responsible for fighting like diseases, virus, bacteria when they come into your body. So HIV basically hijacks these cells to the point whereby they use those cells to replicate themselves. But in the process of replicating themselves, they destroy those immune cells. So when your cells get to the point where it's so low, that means that you are transitioning from HIV to AIDS. So AIDS is the advanced version of HIV, and higher chances of one or more opportunistic infections happening. Opportunistic infections are basically infections that take advantage of the fact that you have a lower immune system to take root in your body. So I always like to use the example that it's not AIDS that kills you, it's the opportunistic infections that kill you because you don't necessarily have the immune system to be able to fight this infection. So how does HIV work in the body? HIV works by attacking your immune system, particularly your white blood cells, that the CD4 I explained earlier, by continuing to infect other white blood cells, eventually leaving very few cells to fight off any disease or infection. The virus duplicates rapidly, and in so doing, it weakens the body's ability to fight off diseases. I use this graphical representation to give you an idea of what's going on in your cells with HIV. Look at the dark section, there's going to be an image that's popping up very soon. So that is the HIV. It gets through the cytoplasm of the cells, goes into your nucleus, and hijacks it and replicates itself to produce more of its cells. HIV itself cannot reproduce itself. It needs your immune system. That's why it's so insidious, because it basically just destroys your immune system in the process of multiplying in your body. So HIV is transmitted mainly through bodily fluids. The main bodily fluids that transmits HIV are blood, including menstrual blood, semen, including pre-ejaculate, vaginal and rectal secretions, and breast milk. However, things like sweat, saliva, urine, tears, and mucus does not transmit HIV. So if a person has HIV and any of the infectious fluids that I mentioned initially ends up inside you, however it ends up inside you, it can give you HIV. The transmission routes are mainly through the sexual route, blood-to-blood contact, and mother-to-child transmission. The sexual route is the majority of infections, how it's acquired for HIV, through unprotected vaginal or anal sex. For blood-to-blood contact, mostly intravenous drug users, they share needles, drug works, including those that inject hormones, steroids, and other body shape enhancers. In the process of that sharing of needles, they can transmit HIV from one person to the other. Also, there are cases where people have shared diabetes needles that has transmitted HIV in the process, because one of the people who had diabetes also had HIV and transmitted it to the next person, so making it a communicable disease. And we also have the mother-to-child transmission, which can happen in her fetus, and it can happen during the pregnancy, during labor, and also delivery and breastfeeding are all chances that a person or a mom who has HIV can transmit it to her child. I use this just quick graph here to show the different demographic breakdowns, racial breakdowns of this disease. As you can see in this graph, African Americans, even though we are probably about 15% or less of the national population, we make up a significant portion of new HIV cases, both for the adolescent age group that shows here and the adult age group. As you move higher in the age groups, African Americans and Latinx individuals have the highest HIV incidence of new cases, and it's something that, as a whole, we've been working towards bridging this gap that needs to be bridged. And I'm just going to cover some information about that moving forward. So why would you say we are disproportionately impacted by HIV as the African-American population and the Latinx population? So there are some behavioral reasons and there are some environmental reasons. For the behavior, we have like high-risk environments, high-risk behavior, lower perception of risk, meaning people think that even though things like HIV and sexually transmitted infections are around, there's no way they can get it. Even though they may live in an environment where there are higher rates of it, they think they can never get it. Also, the mixture of let's say, for example, there's a location where there are both people who are high risk and low risk, but because they're in the same environment, chances of that intermingling, the risk levels intermingling, is very common. Also, substance use, such as intravenous drug use, alcohol, crack, they all have an impact in increasing the chances of a person getting HIV. Environmentally, we have things like poverty, poor access to care, low health literacy, incarceration, high sexually transmitted infection prevalence, all have a role to play in seeing those high numbers within the Latinx community and specifically the African American community. I don't want to go into this too much because it'll take too much time, but we can discuss about this in the conversation after the presentation. But the point that I wanted to make here is that Black youth with low risk behavior are 25 times more likely than whites to acquire sexually transmitted diseases. And also, condom use is higher among Black and Hispanics than other groups, but we are seeing higher numbers in these groups. So there is something a little bit more going on here that we need to address. We need to look into and understand to continue to protect ourselves. However, it's not all doom and gloom. There have been a lot of progress, but we have to garner that progress towards specifically African American communities so that we increase testing and treatment to make it effective treatment within these communities and to make it in such a way that individuals who are susceptible to HIV can get treatment immediately if they get HIV, and also to prevent HIV from taking root into these communities. One other thing is a drug called pre-exposure prophylaxis. It's basically a drug you can take daily, which prevents HIV infections from taking place even if you're exposed to the virus. So we need to make sure that people in communities of color get access to PrEP and adherence to PrEP, making sure that they're taking it consistently. And we need to debunk so many myths, so many fears related to HIV, because that is preventing people from getting the help that they need. And like I mentioned earlier, alcohol and drugs have an impact on increasing chances of getting STI, sexually transmitted infections, and HIV as a whole. And things such as ecstasy and Viagra is a deadly combo. Sometimes people share drug equipment and increases their chances of HIV, and a whole slew of other impacts that these drugs can have on people that increases their chances of having sexually transmitted infections. You look at Solano County, there's a map of Solano County as a whole, and from bottom to top, we have Vallejo, then we have Fairfield, then we have Vacaville, and all the way at the top, we have Dixon. All the way at the bottom right, we have Rio Vista. And each dot that you see here is essentially transmitting infection. The green is chlamydia, the purple is gonorrhea, and the yellow is syphilis. And the point I'm trying to make in showing this graph is that these are the reported cases. And look at it closely. These dots, they are on top of each other. So with what you're seeing, there's so much underneath that you might not be seeing, because all those at the top is covering the ones at the bottom. The reason I show this is that it's so important for people to get tested, to know their status, so that they can continue to protect their loved ones, their partner, so that they don't transmit these infections in the community. Because all these infections have an impact on HIV, or making it easier for HIV to spread in communities. PrEP is one of the greatest tools that we have in our repertoire of tools. And like I said, it's a drug that basically a person can take that protects them from getting HIV, even if they're exposed to the fluids that can transmit HIV. So it's very important that people know that this drug is available in our community. It's being well researched, and it's a resource for people to look into if they think that they have a higher risk of HIV, or whatever the reason that they might be exposed to HIV. This is a way to prevent that. Just going to do a quick overview. Having STDs such as syphilis, gonorrhea, and chlamydia, and others increases your chances of getting infected with HIV and transmitting HIV by 3 to 6 times. That's why it's so important to get tested and always use a condom. And one thing that I need to make people aware is that the PrEP that I mentioned earlier, it does not protect you from syphilis, gonorrhea, and chlamydia. So you have to look at it as part of the tools in your belt to kind of prevent HIV from taking root in our communities. But if you're taking PrEP, you also have to continue using condoms to kind of protect yourself from getting syphilis, gonorrhea, and chlamydia, because there's no drug out there to prevent this from happening. But either abstaining or using condoms, or making sure that your partners are tested, and then still taking part in safer sex practices is going to continue to help the community. And one thing I always teach people, open sores means open doors. When you have these sexually transmitted infections, it causes sores around your genitalia, and that increases your chances of having HIV infections to easily get through those through those sores into your body and taking root and causing HIV. So it's very important. We know all this. Knowledge is power, and we can continue to use this knowledge to protect ourselves. Um, Also, young people aged 13 to 24 account for about 22% of all new HIV diagnoses. So we have to start looking at it in the sense that we have to teach our young people early. We have to teach them the truth about some of these sexually transmitted infections so that they can also use these tools to protect themselves from getting STDs and HIV. These are a few resources we have in Solano County, specifically our clinic locations. For example, in Fairfield, we have the Planned Parenthood. We have our family health services that we have 3 locations in. That's going to be Vallejo, Vacaville, and Fairfield. The Fairfield location address is there and the phone number. Clinical Lay. There are a few that are not on here, like La Clinica. These are all great places that you can go to get tested, to get tools to protect yourself. Also, online resources such as amaze.org is a great resource for parents and for teachers to teach sex ed to their young ones. Act4youth.net, teensource.org. Young people can order condoms for free on there. Pleaseprepme.org is a website that shows you all the locations that you can get PrEP, which can protect you from getting HIV. And we also have our rapid testing number, which is the 707-398-8317. That allows you to schedule an appointment with me, and I can set you up to get an HIV test right there. It's rapid, 20 minutes, we have your results. So it's pain-free. We don't even use blood. We use oral fluids, which is basically saliva. And it's very quick. And that is my presentation for today. I'm looking forward to the discussion so that we can answer any questions that may not have been covered in the presentation.
Can I be the first to say, wow?
Wow.
I think we just need a minute to take it, a few seconds to take it in.
And I'm sorry if I went too fast. I had a lot of information to cover.
No. Well, it didn't help that I said Robertson. We have a limited time frame. I know how you smart folks are. You have a lot of slides. That was a lot, but it was very comprehensive.
Mm-hmm. Mm-hmm. And what's as we were preparing to produce this webinar with Kate Patrice, it was surprising to us around how prevalent HIV and AIDS still really are. I mean, I think over the past 18, 19 months, so much of our life has been consumed with the COVID-19 pandemic. And I mean, at least from what we know of HIV and AIDS from the 80s, to now, I think it's fallen off the radar, Robertson. And so, what do you say about that? What about the prevalence and how we need to be a little more mindful about this and educating ourselves?
Yeah, like you said, you're completely right. The COVID-19 pandemic, at the onset of it, in the middle of it, at the height of it, it took a lot of energy, resources, and time off people like me. I was working full time in COVID during COVID-19, but that didn't mean that the HIV epidemic stopped.
Right.
And from all indications, because of the lack of resources being diverted to that, we saw slight increases in HIV cases. So there has been an impact. However, there's also a positive side to it because of all the attention that has public health has gotten in the last year. There's been more government understanding and recognition how important it is, the work that we do. So there's been more money funneled into the outreach work that we do, the prevention work activities that we do. So we've hit the ground running, and we hope and continue to work towards making this epidemic a thing of the past by continue to offer testing and PrEP, and hopefully in the future vaccines and better treatment for this disease.
My thought was looking at the numbers and toward the early part of your presentation, that the age groups of 20 to 24, 25 to 29, um, looking at those increased numbers, but then looking at the 45 plus, I'm part of the 45 plus, and the numbers are very, very small. And what my thought was, we got it. We got that message 20 years ago. Maybe, maybe this is just what I was thinking. We got that message, but did we tell our children?
That's a good point.
And I haven't. I have a 21-year-old at home. I haven't had this conversation with him.
And
So,
also, oh, sorry, continue.
no, I was going to say, I was just going to own it and say I'm part of
Yeah,
the.
no, you're completely right. And also, I
Uh-huh.
think I grew up in the 80s in Africa, and there was a lot of attention on HIV because it had a significant hold on the population that I grew up in because of the same factors that you see it have an impact here. The communities it impacts are the same communities in the locations I grew up in. And but I grew up in an environment that it was harped on continuously. I knew more about HIV than pretty much any disease when I was like 13, 14. But the same line of thought, I noticed when I was out here, I noticed that the young people of high school age and of college age right now didn't see the height of the HIV epidemic. They weren't given the same tools that a lot of us got when we were younger. So there isn't that urgency that we had that they possibly don't have about HIV.
Right.
Yeah. Well, and yes, the numbers of cases in our young people are shocking, but even more so the numbers of African American, the new cases that you mentioned. So
Yes.
even though we're making up of 14% of the total population, we represent 64% of the new cases.
Yes.
And I think your point about the stigma around the conversation is very well taken. Like even to Kay Patrice's point, I have an 18-year-old and I haven't had this conversation with her either. And I think it's rooted in the fact that as a young adult, the conversations I had about sex were around abstinence. And naively, perhaps, for me, that's perhaps why I haven't had that conversation, is because rooted in spirituality and religion, is that we're having more conversations about abstinence and maybe not having a reality check about what's really happening out in the world. So can you say more about the stigma in our community specifically?
And even before I dig in a little deeper, I wanted to share that I work with a lot of young people of color. And I've looked at a lot of data around this. And what it shows is that when young people are educated about STIs, sexually transmitted infections or sexually transmitted diseases, they actually engage in sex less and engage in sex much later on in life. So sometimes we have this mentality that if we teach them about sex, they're going to actually have sex, but it's actually the opposite.
Right.
So with regard to the stigma is such a huge part of the negative impact in our communities because just for example, I was on a community event not too long ago, and somebody said that they wanted to get an HIV test, and the person's friend came up to them and said, "Why do you want to get an HIV test?" And it there right there is so common that people don't want to talk about it in public. They don't want to. They're even afraid that if they get seen going to take an HIV test or a sexually transmitted infection test, that automatically means that they have it, and they want to kind of protect their privacy. They want to protect their dignity in the community, so they would rather not even know than potentially go take the test and somebody find out and put them on that list of not necessarily being a good person or a moral person. So stigma is definitely a huge portion of it that we need to work on as a community so that there's open discussions about these things so that we can actually address the challenges.
Would you say that when I think about who should be tested, I mean, should we just make it commonplace to be tested?
Oh, absolutely.
Yeah, because I've heard that you go to you do mobile testing. Did I
Yes.
hear that right?
Yes. Yeah.
So when I think of that, that means I should be able to go to the farmer's market
Mhm.
and just be tested. Is that how we should think of it? Is
Yeah, think
that
of it
common?
that way, as in, see these COVID tests that we are doing all over the place. It's very easy to access. Let's say you want to travel, you want to make sure that you get your COVID test. That's how you should look at HIV. Let's say, for example, you get into a new relationship. You want to make sure that your status is clear, their status is clear, and but at the end of the day, you want to make sure that these tests are accessible. There are a lot of places such as Target. You can just go to a Target and get an AuraSure. That's the oral rapid test. You can look at any a public health organization within your county, within your city, within your community, and be able to get a free test. You can go to a health and social services clinic, and you can request for an STD panel, and more often than not, it's going to be free. So these tests are available. It's just that people don't know that they are that accessible.
Right.
So you've given us a few instances that would trigger someone thinking, "Oh, I need a test." So one is new partner.
Mhm.
I guess another would be uh, what I say, drug use, sharing needles. I
So,
mean,
so the way I look
yeah,
at it is everybody's risk level is different. And
okay,
when I say risk level, meaning like, are you having unprotected sex? Are you having intravenous drug use? Everyone is different, but on average, I advise people to take a test at least once a year.
okay,
So, and when they're doing their test, they do an STD panel so that they just clear all that, and also do an HIV with the STD panel. And you basically know, and having your test doesn't mean that you can go out and have unprotected sex. It's just that to make sure that you are aware of your status, and in case there is something, you can get treatment immediately, because a lot of these STIs don't show symptoms. People think that unless they see this, or
mhm,
when it burns somewhere or itches somewhere, then they may have something. But 90% of the time, there's no symptoms. And HIV usually doesn't show symptoms for at least 10 years.
oh
But during
wow,
that time, you may have multiple partners that you may give something to them. And yeah, so it's very important to get tested and also use condoms. And if you're somebody, let's say, for example, an intravenous drug user who continuously uses intravenous drugs, then maybe PrEP may be an option for you, because if you take PrEP, it gives you protection from HIV, but it will not protect you from something like hepatitis C, which is very common in intravenous drug use.
mhm. This really helps, Lakeithia. For me, I feel like I can imagine me, just as the kind of leader of these type of conversations in my house saying, okay, we have our annual doctor's visit and we're all getting our HIV tests as well. Just kind
Yeah.
of making it just that common, the whole house where we're all
Absolutely.
going.
And that addresses the stigma.
Yes. And I had the pleasure of, when Robertson and I met in person for the first time this week, to actually watch him in action, at a mobile site, at a community event. And it is, I think the other piece of the stigma is people are like, oh, I don't want to take someone to take my blood,
Mhm.
and it really was a simple oral swab. 10 seconds, I believe you
Yeah.
said, it was, as I watched you, kind of instruct someone through the process. And so I think that's the other piece of the stigma, is that folks may be scared that it's some really invasive
Mhm.
test, um, and also you may be being afraid of the outcome. But I think the fact that it's a rapid test, that you're here as a professional providing guidance, counseling, and resources and services, is really reassuring, for folks to actually get out there and just know your status. I
Yes,
think that's step
absolutely.
one.
Very important.
I think you really named it. It's for me, it's the outcome. Like, if I come back positive, Houston, we have a problem. I've been married for 20 years.
But this, the
Have
way I like to look at it, is better for you to know
Mhm.
know, because if you know, you can get on treatment really early, and with all the advances with HIV treatment, you can live a very normal life. There are people who have HIV who are living into their 70s and 80s. So
Wow.
yeah, it's
Well,
better to know than not know.
let's talk a little bit more about that. What does that look like? Someone tests positive.
Mhm.
I'm assuming, just because with COVID test, you get it right on your phone.
Yeah,
You look, you click. Oh my goodness, what? I'm positive.
yeah.
What
So
happens then?
the way we do it, so I had to go through training to be a counselor to be able to do this test. So as I take the swab from the person, the 10 seconds, as Laketia shared, I put it in a little like receptacle that does a kind of like a chemical reaction. And as that's going on, it takes 20 minutes to get the results. So the 20 minutes is the time that I use to counsel somebody. So we, through the counseling, go through risk factors, that is things that may increase your chance of getting HIV. But another thing that we talk about is, in case it comes back as positive today, do you have a support system? Do you have somebody that you can talk to? So these are all things that we consider, we talk about, and also if it comes back as positive, we don't call that a positive HIV diagnosis, because it's we look at it as a screening test. So
Mm.
if anything that comes back as preliminary positive, we have to do a blood draw, a lab test that confirms that, okay, this person has HIV. Because sometimes you never know. Like our test, after I think 90 degrees degrees Fahrenheit, it can impact the results a little bit. So you have to keep our tests cool. So if it comes back as, and we do keep our tests cool, but if it comes back as a preliminary positive, we have to do a blood draw to confirm it. So there are levels and stages to kind of make sure that people are taken care of.
And I think that conversation that you're having in that 20 minutes is, really important to set the stage, regardless of the outcome of the test, right? Just to give that person the education and information that they need to navigate moving forward until their next test the next
Mhm.
year. I wanted to transition a little bit into equity. We know that health equity is it's a big topic right now, and we see the disparities in the new case rates as it relates to African Americans. And by and large, we're intentional about this work reaching the African American community, specifically women,
Yeah.
because Delta Sigma Theta is a woman based organization. So can you share more about kind of the high risk population as it relates to both women and African Americans and the inequities that we see there?
Yeah. So I'm going to give you a little bit of a quick overview in public health. There's something called the social determinants of health.
Hmm.
So social determinants of health, you have to look at it in the sense that in this world, we don't live in a vacuum. We live in a society. We live in a place of laws and policies and interactions, racial inequities. All this has an impact on people's health. And unfortunately, these social inequities, policies, they seem to be disproportionately affect people of color, specifically African American people, and also Latinx individuals. And even within those groups, women usually are disproportionately impacted by a lot of these diseases, not just sexually transmitted infections
Hmm.
as a whole, but that allows us to really take a step back and see how we should approach our initiatives. But before I delve into that, women as a whole have a higher risk for sexually transmitted infections. It's easier for a man to give a woman HIV than it is for a woman to give a man HIV. Because you also have to look at it in the sense that, like I shared earlier, HIV is transmitted through bodily fluids. So if a man ejaculates into a woman's vagina, the ejaculate has a lot of HIV in there, and it goes into a vagina where it's an enclosed space. It's not going anywhere. It's just sitting there, and it has more of an opportunity to get through and infect. However, a man, on the other hand, it's a quick in and out, and boom. So the chance of HIV is much lower. However, that doesn't mean that a person can just have sex heterosexually without wearing a condom and think that they're completely safe from HIV. You have to continue using a condom. However, just to show that the infection rate is much easier for women to get. Um, so yes, you are right. It definitely has a disproportionate impact. So a lot of our initiatives, we are cognizant of that, and we make sure to some of the research I do. I even look at color, which African American communities respond to make sure that the condoms I buy are specifically in those packets or packages that attract our members in our community, so that to encourage more people to wear condoms or use condoms. I buy a variety of different condoms, thousands of them, and distributed all over the county to make sure that people have access to different kinds. So it's not like if this doesn't feel comfortable, there's a ton of other ones that are comfortable. So we try to make our initiatives encompassing to make sure that our community is recognized and that we actually have the tools that we can use to protect ourselves. There's still a lot of work that we need to do in equitable access, but I think with the support that we're getting, there's a bright light at the end of the tunnel.
Yeah, I agree. This has been really, really great, and I really, our hope is that those that have joined us have learned a lot. I mean, I was feverishly taking notes as you were sharing information, Robertson. And I mean, I think just around the data for not just for Solano County, but for California as a whole, the stigma that we talked about, and particularly in the African American communities, how education is so important, especially for our young people who are being adversely affected, along with women, Black women. And I wanted to just open the floor just to you, both of you, for any final statements or comments as we, start to close this session. Kay Patrice?
For me, I say that this conversation has empowered me to have some really great conversations starting today in my own house, and to openly have conversations in the community so that people feel comfortable taking the test. And I will commit to also taking a test in, I was going to say March. I usually do my physical exams every March, my birthday anniversary. And you know what? I'm going to get that done in the next 30 days. So you've changed me. I'm on board.
Thank you. Yes. We love to hear that. Robertson, how about for you? Any closing thoughts or anything that you want to share with the audience before
I
we?
think the main thing I want to share is HIV rapid testing number. The number is 707-398-8317. You can call or text, and we can schedule you in for an appointment. We also offer the home testing kits where you can grab our HIV testing kits, which is also oral. There are great directions in the packet, and also there are videos online on YouTube as to how to do the swab, which is super easy, and how to tell the results of the test. And I think this is a great tool that people can access through us. So the number again is 707-398-8317.
Great. Well, thank you both so much. This has been really informative. And thanks to those of you who are joining us online, again, in observance of World AIDS Day. So this is a nationally recognized observance for our organization, Delta Sigma Theta Sorority Incorporated, but is also recognized by many organizations worldwide. And so our hope is that you've gained a better understanding, you've gained some knowledge, and enough information to share. But before we go, we also want to share our call to action, right? I mentioned at the beginning, we had a call to action. So our call to action for you watching is to help us to stop the spread of HIV by first knowing your status, right? Get tested. And then secondly, let's remove the stigma around HIV and AIDS and start to have open conversations with your friends and family members and just in the community. And to that end, we'll give you an opportunity to join us again. Actually, all of us, all three of us on Saturday, December 11th from 9 a.m. to 11 a.m. at Emmanuel Temple Apostolic Church in Vallejo. We will be holding a World AIDS Day Health Fair. And at that fair, you will, Robertson and his team will be on site that day, as well as myself, Rhonda Smith, the co-chairs for social action, and our chair for international awareness and involvement. Again, this is a national observance for World AIDS Day. And Kay Patrice and her organization, Empower Solano, and many other organizations will be available to provide again, the free HIV rapid testing, additional health screenings, COVID testing, and other resources and services. And so we really hope to see you there. But once again, we thank you so much for joining us this evening. Take care, be safe, and be well.
Bye, everyone.
Bye.